Hospital in Delhi. Over to you, Bhavna.
Thank you, Rinki. So, good evening, Dr. Sibal, and a warm welcome to CII IWN's Need of the Hour. We are very, very privileged to have you with us today. Dr. Anupam Sibal is a senior pediatrician and he's the group medical director at Apollo Hospital. Dr. Sibal, it is really, really a privilege to have you with us.
Good evening. Thank you very much for this invitation. Delighted to be a part of this wonderful program. Thank you very much, Bhavna, Rinki, Zia. What I'm going to do is basically just talk for the next few minutes about what every mom wants to know. I guess you've not invited dad, sadly. So what every mom needs to know or wants to know. So today is day 492 of the COVID pandemic. You know, time does fly. We're going to hit 500 next week. There have been 155 million cases. India has reported more than 20 million cases and the figure is 2.07 crores. So huge numbers. But while on one side we've been grappling with the pandemic, we also have an infodemic. And by that, I mean is that if you go on to Google and type COVID-19, you get 6.18 billion results. Now you type diabetes, you get 460 million. So we've got like 8 times more information about COVID-19 than we have about diabetes. And diabetes was first described in 1552 BC, whereas COVID was first described on 30th December 2019. So see, the amount of information, the amount of access to information that we have is just mind-boggling. Now, we as doctors need to keep ourselves abreast of what's happening in the published literature world. So we go on to PubMed, which is where all the peer-reviewed papers are published. And when I first started tracking COVID-19, there used to be like 10, 12 papers a day. Now, there have been more than 131,000 papers, and that works out to 266 papers per day. So by the time this session finishes, 6 papers in 30 minutes would have got published, and they might be pretty relevant to how we're going to look at COVID tomorrow. If you look at COVID-19 in children, it's like close to 13,000 papers. So just imagine about 10% of all the literature is devoted to kids. If we look at vaccination, which is of course a burning topic, 10,000 papers. And if we look at COVID, vaccination and children, they're about 1,000. So clearly a huge amount of interest. Now, how common is COVID-19 in Indian kids? According to the NCDC, which is the National Center for Disease Control, in children up to 10, it's about 4%, and 11 to 20, of course, the cutoff is 18, is 8%. What are the symptoms? The symptoms are the ones that we are so familiar with. A little bit of fever, there could be fatigue, there could be a cough, there could be this just general feeling of not feeling well. Of course, the vast majority of kids do not have any symptoms, and the younger kids really have no symptoms. But then we also have kids presenting with, say, vomiting, diarrhea, or nausea. They could have headache, they could have muscle pain, they could have behavioral changes, especially the young ones. And what we are seeing this time in phase 2 or wave 2 is more vomiting and diarrhea kind of presentation. And then, of course, I have to mention this MISC, which has really caused sleepless nights to parents across the globe, first described in Europe. Basically, it's a multi-system inflammatory syndrome in children attributable to the SARS-CoV-2 viral infection, where 3 to 4 weeks after the COVID-19 infection, the child becomes symptomatic, develops fever, can get very sick. There could be a rash, the eyes can get red. The child could actually have low blood pressure, could start to have bleeding, lots of skin manifestations and neurological complications. But fortunately, this is rare. It has been reported more in the Caucasian population, though of course a handful of cases have been reported from different parts of India, notably Maharashtra. How do you make a diagnosis? It's clinical, you want a confirmation. So, you can do a rapid antigen, but if it's negative, then it doesn't mean anything. So you need a confirmatory test. That's a genetic test. So you do RT-PCR, and every kid is familiar with RT-PCR, or you do a gene expert, which is CB-NAT, which of course is much faster. Blood tests are not really needed if the child is doing really well, but if there are significant symptoms, then we of course want to look at markers like CRP and ferritin and so on and so forth. But most kids do not need any blood tests. Do kids need a chest X-ray? The answer to that is no. Do they need a CT scan? Definitely not, unless the symptoms are pretty profound, because you don't want a child to be exposed to radiation. So quite different to how adults are managed and how adults are investigated. Hospitalization, um, uncommon, and thank God for that. Over the last few weeks, not had to admit a single child. Even if we look back at the last year, the number of children who needed admission were very few. So that's great news. When would we want to admit a child if the child is not able to maintain saturation that is more than 94%? Then that's the time we need to look at the child, examine the child, and decide on hospitalization. Or if the child's very seriously unwell, and a mom can always tell if there's very high fever, the child is miserable. And of course, in some children with MISC, because we have to give them specific treatment like steroids, they would need admission. What are we seeing differently this time? We're definitely seeing more children this time. And what we are seeing, which we didn't see the last time, you could have a husband out of a couple be positive and the wife be fine, and they've been together for several days in the same room. This time around, if someone in the family gets it, pretty sure that in a week or so, virtually 70-80% of the family will turn positive. This includes kids. Most of these kids, of course, have zero symptoms, but they get it and they spread it. So we are definitely seeing more kids. We are seeing more kids with diarrhea and vomiting, but fortunately, we've not had hospitalization. I'm really delighted about that. Vaccination. Everyone is really concerned about when will vaccination come for children. Of course, as we all know, there are several vaccines now licensed for use globally in adults. There are 3 licensed for use in children. I'm sorry, in adults in India now over 18. The 4th one should get licensed very soon, and then we might have the Pfizer, J&J, Novavax, and maybe the Moderna. As far as children are concerned, the first vaccine to be licensed was the Pfizer vaccine, older than 16. Canada yesterday licensed the Pfizer vaccine for 12 to 15, but Algeria was the first country that licensed it. Trials are going on with Moderna, with Covishield, with Covaxin, with Sputnik, with J&J, and Pfizer believes that they will have data by September in children from 5 to 11. And of course, then they will be doing a trial, or they would have made significant progress in a trial in children from 6 months to 5 years. So when will we get the vaccine in India? Well, everything's fast tracked. So I guess we should see a vaccine sometime, Diwali time is, I believe, when it's likely to be, give or take a couple of months here or there. So before we open it up to Q&A, 7 tips that I'd like to give to all the moms. The first is, do not panic. Please do not panic. There's no need to panic. Isolate the child. That's extremely important. Keep the child away from grandparents, because if grandparents don't have it, we don't want the grandparents to get it if you're living in a joint family. Please pick up the phone, talk to a pediatrician, do a WhatsApp, do a teleconsult, video consult, what have you. Go through the symptoms, let the pediatrician go through the scenario in the family, decide on the need for tests, which tests, when. Please follow the advice the pediatrician gives you. It's extremely important to follow it and not to sort of either overdo the advice in terms of adding things to it or delete items. Please do not self-medicate. That is just something that is not acceptable, and there are enough prescriptions floating around with 10 drugs, 12 drugs, 15 drugs, 20 drugs, what have you. And please do not ever look at an adult prescription and decide, oh, my child's 4 years old, so I can divide the adult medicine by a fourth and give it, or half or 2/3. Please don't do that. Children are not miniature adults. And please follow the quarantine protocol, whatever you are advised, 11 days, 14 days, whatever because it's not like that the child is going to become less infectious because he or she is a child. So these are my 7 tips, and open to a Q&A.
Wonderful. Thank you so much, Dr. Sibal, because that's really, you've at least taken a lot of, the most important questions, and now we can actually go into the audience and ask them directly. Before we do that, I just have one quick question for you. So there's a whole debate around remdesivir. So is it good for kids or not for kids? I mean, what are your thoughts on that?
So, if you look at the data that's been published on remdesivir, and there's tons of data, well, what it does is it does decrease hospitalization stay. So the duration of stay in the hospital is decreased. It doesn't really actually save lives, does not actually decrease the need to go onto a ventilator. There obviously were some kids in the trial that was conducted, and multiple trials
Yeah.
were conducted. So remdesivir is under emergency use authorization, uh, allowed to be deployed or given to children. But of course, it
Yeah.
needs to be given in the hospitalized child who's dependent on oxygen and is unwell. So it's not something, hey, listen, let me throw in a little bit of remdesivir at home. Firstly, it's not allowed at home and it's not indicated. So I think this whole thing of remdesivir, tocilizumab, and all the other monoclonal antibodies, I think has been a little overdone. And I think, people are very worried. So if they hear of something that might work, then all hands on the deck kind of approach. But really, it needs to be a little more judicious than I believe it has been when it comes to families looking at medication.
Okay, wonderful. Thank you for that. So I think we'll just straight away start with audience questions. From Baba, what about the third wave?
So, there's this new term that has been coined in the last couple of days. I think that the third wave is going to hit kids. Okay. Well, it all depends on how soon we are able to vaccinate adults. Yes, if we are able to vaccinate the vast majority, and I hope and pray that happens very quickly,
Yeah.
then it'll be kids less than 18 who will be left without the vaccine. So they are vulnerable. And it is likely that we will see more kids getting infected as adults will have a fair degree of immunity. But having said that, the way this wave is going, a lot of kids would have already got infected or had an asymptomatic or a subclinical infection, and they would have some amount of natural immunity. So yes, a third wave is likely, uh, and a third wave might actually touch on more kids than it has in the first and the second waves.
Yeah, so the first was much less and the second's already been hit so badly. Yeah, we see that. Okay, thank you for that. Tanvi said thank you for sharing this data. What are some of the manifestations, known manifestations of post-COVID-19 conditions?
What we've learned is that the SARS-CoV-2 virus can virtually cause anything other than a pregnancy.
Wow.
So you have people with GI disturbances, with their tummy getting bloated, and you can have constipation, you can have all kinds of muscle aches and pains, you can have weakness, you can have neurological signs, you can have cardiac issues. This is as far as the COVID fog is very well known now.
Yes.
You tend to forget things. So that is all very well described in adults. The specific syndrome that has been defined in children is the MISC. But like I said, it's very rare. But you do have some kids who complain of weakness for an extended period of time. But many of the adult manifestations we don't see in kids in what is described now as long COVID.
Right. Okay, thank you for that. From Rinki, what is CRP and what does it indicate?
CRP is a marker for inflammation, and it gets positive when you have bacterial infection, when you have some kind of inflammation going on in the body. So it's a marker. On its own, it doesn't tell you much, but you look at a trend. You have to put everything together in terms of the clinical picture, fever, is the child well or not, and then you decide what you want to do based on the CRP. So it's an inflammatory marker, one among many.
Okay. And it helps you piece together a composite picture for a child, right? For Zia, we've got how does COVID impact children who have cholesterol or are pre-diabetic, diabetic, or have liver issues?
Okay, now it all depends on what do we mean by liver issues or kidney issues or heart issues. So now if we, as you know, have a lot of congenital heart disease, we have a lot of liver problems that kids are born with. So if a child has chronic liver disease or a child has chronic kidney disease or a child has heart disease or has unfortunately a hematological condition or has undergone treatment for cancer, now these children are more vulnerable to getting um, COVID-19 and sometimes can have a slightly more complicated course. But if someone's LFTs are slightly abnormal in that their enzymes are a little high or their cholesterol is slightly off, or the thyroid profile is slightly off, that does not in any way put them at a higher risk. The good news is, unlike adults where you run into trouble with coexisting conditions,
Right.
compounded by the fact that this virus is rather severe on those older than 50, we fortunately don't have that problem in kids, and thank God for that.
Thank you. From Sonali, we've got my 18-year-old son went to the US with a single jab of Covaxin. But now seeing the situation in Delhi, we would have to ask him to stay back. Can he or should he take a Pfizer shot there or just wait to get back?
Well, that's a very interesting question. And this question is going on, coming up with so many vaccines that have become available. There's one study going on in the West looking at, hey, one dose of Astra, one dose of Pfizer, one dose of Pfizer, one dose of Moderna, one dose of Moderna, one dose of what have you. Now,
Yeah.
nobody's going to do that study with Covaxin because Covaxin is an Indian vaccine. So that study is not happening, at least to the best of my knowledge. So I think what we're going to have to do is just wait for a bit as that data on interchangeability of vaccines sort of emerges. Then a call can be taken of whether he should take Pfizer, because it's really hard when you're dealing with a condition like this, which is not going to go on and on, that people are going to be able to stick to one vaccine. So interchangeability will become something that we have to address, and hopefully should get addressed in a few weeks. As far as your son's case is concerned, he's in a safer place today, and I would keep him there. And then we can take a call on whether he should get the Pfizer, because he can easily get the Pfizer or the Moderna vaccine now if he's 18, and then take a call on whether you want to bring him back in here.
Thank you. From Tanvi, for a breastfeeding mom, do you recommend Covaxin or Covishield?
Doesn't matter, but definitely not an issue. Initially, there were lots of questions about lactating mothers and pregnant ladies. But interestingly, when the trial data was looked at, 9,000 women who didn't know they were pregnant actually had the vaccine. So that became a cohort to study what happens. Because you never study a vaccine in children, you don't study a vaccine in pregnant ladies, you don't study a vaccine in lactating mothers. But now that we have a lot of information and real-time information about the vaccine being deployed in millions and millions of people, breastfeeding is absolutely fine. Go ahead. Might even offer some protection to the baby. Doesn't matter Covishield or Covaxin.
Okay, that's our second part of the question. She has two kids, 20 months and 4 years old. If I get COVID positive, how do I isolate my kids? Can they stay with me, at least the one who is smaller and still breastfeeding?
It's tough. It's not that the 4-year-old is going to go away. So you have to wear a mask because kids can't wear masks, especially the 4-year-old. 20 months, of course, is unthinkable. So wear a mask and keep them with you. That's the practical option because it's pretty traumatic for them to be away from their mom.
Okay, thank you. From Shreya, does a 1-year-old need any additional supplements aside from vitamin D and iron as a precaution?
I wish we had something that could actually, help our immune system react or, become stronger or prevent this virus from getting into the system of our kids. But, we in fact, everybody does give zinc and vitamin C, and my perspective is it does no harm and it's safe. So that's fine. But that's about it. You don't need to do anything more than that.
Okay, thank you. From Rinky, for my 16-year-old daughter, I'm not being able to register on CoWIN. By when do you think the portal will open for new registrations? Is there any way of getting the vaccine with registering on CoWIN?
So 16 is not authorized.
Sorry. Yeah, sorry.
No, so nothing less than 18 is authorized because these vaccines are not licensed for use in India and children. The CoWIN app is pretty tight, like it was initially about older than 45, and then it opened to 18 onwards. So, we can't really get your daughter registered at this point in time. Give it some time. Hopefully the 16 to 18 and 12 to 15 should happen earlier. And then, of course, the younger than 12 should happen.
Wonderful. Thank you. From Jasleen, if I got the first shot and I'm not being able to get the second shot due to shortage, what happens?
You will get it.
Ask that I can take the second shot.
There's no shortage. It might be a week or two, and it might not be in the place you got it, because with the new system that's come into effect, the access is quite different to what it was in the first phase of vaccination, which was for older than 45. There were a lot more facilities. Now, there are a lot more facilities in the government sector and few in the private sector. But, as the vaccine manufacturing capability and distribution network gets strengthened, you will get it more across the board. But there is no shortage. I mean, like we at Apollo are vaccinating, in I think 50 or 60 places across the country every day. So there is no
Okay,
problem.
thank you. From Megha, is high fever a concern? My 9-year-old on day 4, his CRP was 2 on, my 9-year-old on day 4. His CRP was 2 on day 1. Tomorrow is day 5 and CRP test will be repeated.
We have to look at the whole picture. Yeah, high fever in itself doesn't mean much. It just makes the child and the family miserable. But if the fever persists, say like day 6, day 7, then there might be a need to sort of do a more comprehensive assessment in terms of other blood tests. Like I said, we don't jump into doing tests. We don't jump into doing a CT scan. If we are not going to change the management, it's not for recording. I recorded this test or that. No, it's not important. Unless you want to change your treatment based on the test, why do that? And that applies to everything in medicine. I always ask myself this question: what am I going to achieve out of a simple blood test? Is it really going to make a big difference? Because it is a big deal for a child to undergo a blood test. It really is a big deal.
Fair enough. Surinder, will giving vitamin C and D regularly to kids help them build immunity?
So, how, this whole concept of how do you build immunity? Okay, so we don't quite have the answers, because if we did, if we had that magic potion, that would be wonderful. So, how do you build immunity? You build immunity by actually having a healthy lifestyle for children, which means appropriate nutrition, the right mix of carbohydrate, fat, proteins, making sure that we have enough minerals and vitamins on board. That means having vegetables, which is not easy for kids, having fruit, that's important. Vitamin D deficiency is rampant, so vitamin D for sure. Vitamin C, we've known for decades, it helps prevent cold and cough. So that's where that comes in. Zinc has been shown to, in some way, like I said, I'm not sure about the benefit, but it does no harm. So that's really what we have in terms of immune boosting, or, sort of prophylactic protective therapy, for want of a better word.
Doc, doesn't vitamin D actually, if given, I mean, I think it has to be monitored, right?
No, but you don't go around giving mega doses, but
Yeah.
in doses that are normally about 800 units a day is fine. If you want to give 60,000 units, then those are under monitoring, and how you have to be administering
Sure.
determined by your pediatrician.
Okay, and Megha, I think, is asking really about the progression of the disease. So will the fever begin to come down post 5 days?
It usually does.
Okay, then from Shivani, wonderful doc, you've covered all the relevant points. Want your thoughts on the use of ivermectin and FabiFlu on adults, and do you advise its use for children 10 years and over?
So considering that, Shivani, you research the amount you research, I think I should be asking you these questions myself, but not a good spot. So as you know, the data on FabiFlu is very limited. It's a hard enough drug to have on day 1, because just the number of tablets is too much. So that's as far as FabiFlu goes. As far as ivermectin is concerned, there's just been an analysis looking at a lot of retrospective trials. So the purists will say that, the grade of evidence to support its use is not very high. There are those who believe that, it's a good drug. I think we'll get some more data out on ivermectin. And your question about, FabiFlu is not even, I think, being studied in any great detail in kids older than 10. And even ivermectin hasn't really been looked at in very young kids.
Okay, wonderful. Thank you, Doc. So Anviksha is asking any specific precautions that one can take with children under 10, and so is there anything that you could suggest?
Whether it's 10 or 18 or 20 or whatever, the bottom line is what we are seeing just now is unprecedented. It's very different to what we saw in phase 1. So please don't let your guard down, even if you've been vaccinated, even if you've had it. Please maintain SMS, so social distancing, masking, sanitization, and please banish this term bubble. There is no such thing as a bubble. IPL saw that bubble, and we guys were, as medical partners, looking at the bubble, and that was a serious bubble. Once you got into a hotel, you were not allowed to meet anyone. You got room service. You didn't come into common area, and yet cricketers have got it. So this concept of I will mingle with my best friend and the two kids because I'm in a bubble. There is no such thing as a bubble. You have absolutely no idea who your best friend is getting exposed to unknowingly through her staff or what have you. So please, I know it's sad. We went through 2020, looking forward to 2021. 2021 is turning out to be worse than 2020. I firmly believe that 2021 is definitely going to be a lot worse.
Yeah.
Because by the time we finish vaccination, it's really going to be several months because we really need to vaccinate the community at large. And then what we are seeing with all the mutants and so on and so forth and the breakthrough infections. So, it's going to be a tough year. So condition your mind to spending we've always said this, right? Quality time. Now you have quantity as well. So tons of time with your kids, no excuses. So it's quality and quantity this time around. God's made it that way.
Yes, and I think one thing that you said is very key is that this whole bubble thing that we're going with, but it's all spider webs. We're all spider webs. So I think we really need to keep that in mind. It's not a one-to-one, it's a one-to-many that we're coming in contact with every single person that we interact with. Yeah, from Sushmita, we've got, it is said that only Covishield is it acceptable for traveling? What about Covaxin?
So listen, ITA is not going to be in a hurry to put out any of these passports that have been debated now for months. Let's get real. Whenever you have a policy that's global, it has to be fair, it has to be equitable. What do you do for somebody out of the 53 countries in the continent of Africa? If you say, listen, I need a passport, I need you to show me that you had 2 doses of vaccine. So I just want to take this away. There is no such thing as I have traveled with this vaccine or that vaccine, I'm going to get entry. Every country is going to decide what they want. Every country is going to insist on an RT-PCR or a CV NAT before coming in. That's fine. They're going to say, are you vaccinated or not? But even if you're vaccinated, does not mean that you can't spread it or you're not carrying it or that you're asymptomatic. So yes, many countries will say it's good to have the vaccine, and whatever vaccine is licensed and you've had is fine. Also, you need to have the RT-PCR test, and I'm sure the rules will keep changing. But just because you've used a vaccine that's been manufactured in India, that's an Indian vaccine, does not put you in any disadvantage.
Okay, wonderful. Thank you. From Namita, many moms are worried that the COVID vaccine interferes with young girls' menstrual cycles and causes infertility.
I need to meet the person who designed that WhatsApp about periods. What have we been? I've been a pediatrician for 25 years. What have I done for 25 years? Right? I've been vaccinating everyone and not ever asked a young girl about her periods. It's just so ridiculous. I need to meet that man. And I wish he's so good at packaging. He's so good at messaging. He should do some really solid positive messaging. And I think that'd be a great service because this message went like wildfire.
Yeah.
Zero correlation between periods, vaccination, immunity. Zero correlation between fertility, vaccination. A lot of debate about the mRNA vaccine when it first developed, fertility in girls, fertility in boys, really no correlation. It becomes a part of your genome because it's mRNA. In God's name, we've been using DNA vaccines forever. It's just that it's an mRNA vaccine, the first time in the world, but that doesn't mean that we extrapolate stuff it just doesn't make any sense.
Sure. From Shivani again, also, if I took my Covishield 10 weeks back, do I have to take my second shot by 12 weeks or can I wait another month and take the second dose as Covaxin? The reason I'm asking is I had a strong reaction to Covishield, which lingered for 5 to 6 weeks. So I'm a bit apprehensive to get the second one of the same.
So, Shivani, you're not going to get this answer from a scientific point of view because nobody's trying Covaxin, Covishield combo, right? Now, if you had a bad reaction to a vaccine, well, maybe your antibody levels like crazy. So, although I do not recommend getting antibody levels done, but I think in your case, maybe we should. And if they're sky high, maybe you want to wait. But the biggest interval that has been recommended for Covishield based on the data in Europe is 12 weeks. So I guess in the next week or so, get your antibodies done and then take a call. But if you want to take Covaxin, nobody's going to be able to tell you, is it a good thing to try that or not, because there's going to be no data on that.
Okay. Thank you. And from Glossy, does zinc give gastritis symptoms to
Yes, it
children?
does. It does in everybody. It can in everybody, but it does in a few people. Yes, it does.
Okay. And for how long can you give vitamin C and zinc to 2 years old at a stretch as a preventive? Also, what mask do you suggest for 2 years old? It seems impossible to keep them on.
So as far as vitamin C is concerned, you can give it for months. Zinc, not really needed for an extended period of time. Masks, get them Spider-Man masks and stuff like that. So get them all those cloth masks that have cartoon figures. They can kind of like them. But if you're going to look at the brand, and anyway, I'm sure all the ladies here have a fantastic collection of masks that go with the color and the dress and what have you. So go buy a few. I've seen some really fancy ones, I have to say, over the last few months. So please get some fancy ones for the kids as well with cartoon characters, and I think they'll like it.
They'll wear them. Okay. And Jasleen is asking for her parents. They are on day 5. Vitals are under control. Is a CT scan required or only if they have symptoms?
It's an individual based decision. You don't go around getting CT scans done in everybody because, if they don't have symptoms, they've, with God's grace, a mild illness, no real significant illness. So what is CT going to show you? 5 on 25, 4 on 25, doesn't change. So you have to see the larger picture.
Okay, thank you. We've got a lot more questions. I know we are at 6 o'clock. So
I'm happy. I have my next one at 6:20. So I'm good to go for another 15 minutes.
Wonderful, Doc, because we've still got a lot. Okay, so from Sonia, hello, Doc. My child who is 15 years old is COVID negative now since 2 weeks, but he sleeps a lot, about 12 to 13 hours a day. Is that normal?
Like I said, kids, everybody behaves very differently. So maybe this is some amount of fatigue that's set in, and if he wants to sleep, what's the big deal? There's not that much happening anyway outside.
True. Okay, from Rachna, if you had 1 shot of vaccination and then had COVID, after how much gap should you take the second shot? This seems to be a very common question.
Definitely, who thought that we would reach that stage where you're getting that? And I would love to say now that you've had COVID, don't have the second vaccine, but we are seeing all kinds of combinations. So I would say 4 to 6 weeks. If you were living in Germany, they would have said 90 days, but at least 4 to 6 weeks. That would kind of seem reasonable.
Right. Okay, Doc, what's the maximum gap for Covaxin, please? From Sada.
The manufacturers recommend 4 to 6 weeks, so we'll have to go with what the manufacturers say.
Right. Okay. I had in excess of 400 antibodies after 1 dose of Covishield and having had COVID 7 months ago. Can I take my second dose of Covishield at 7 weeks? This is from Shreya.
Shreya, you might as well. So you're going to get really solid antibodies because if you had 400 with dose 1, in the environment, I would have said maybe 4 to 6 weeks ago, okay, it doesn't matter, wait a bit. But in the light of what we are seeing, I would have it.
Okay. Again, we're getting asked the same question from Ranveer. Gap between first and second dose, Covaxin or Covishield. If gap increases to take second dose, what's the maximum gap?
So I think I've answered that. 4 to 6
Yeah, I think. Okay.
Up to 12 weeks, you can't interchange based on evidence.
Okay. From Ekta, is it possible to get infected again if I have recovered fully on the 25th of April? I am fearing the other strain.
Well, anyway, you don't need to worry for a bit. Now, 25th April, so you're really in the honeymoon phase just now.
Okay.
So you're cool for now. But theoretically, you're on the risk of getting it again. And I hate to say that, but, we did not in the first wave see anyone get it twice. But we are seeing in the second wave. So please, follow SMS. And at some point in time, vaccinate.
Can we get the vaccine without registering on the app?
Doc, you're on mute.
Okay, I didn't do that, so it got muted from the back end. But sorry. So I was saying that the CoWIN app. In fact, we need to be pretty proud of the vaccine program. It's digitally driven. It's evidence based. The whole stratification of which phase 1, phase 2. I'm so glad they did it that way. And no, nobody can beat the system. So you have to register in CoWIN. You have to get your Aadhaar card and all the details, and then you have to get your slot, and then you have to dutifully go there and get your shot.
Okay, and from Surinder, if you're sitting comfortably at home and you're safe, should you still go and get vaccinated because of this wave?
The question is, how long is this wave going to last? If I could tell you, hey, listen, 1st of June, it's going to be fine, then I'd say sit at home. But the answer is it's not going anywhere in a hurry. So please mask up, go. Your time there is going to be minimal. There's going to be social distancing. So go ahead and get it done. This is something you have to do. So
Okay.
don't procrastinate. Just do it.
Okay. From Shahina, in children who do contract the COVID virus, what are the long-term precautions or things vitals to look out for, and for how long?
Just think about it as it's a bad dream and it's over. Don't think about it too much.
For
Don't worry,
child,
it will happen, that will happen. Don't read up and don't read about MISC and so on and so forth. So just let it be. Recovery made, forget about it. It's in the past.
okay. From Rinky, how do oxygen concentrators help? Should we have one at home? And will plasma therapy help children?
Okay, so plasma therapy, and even in adults, is very iffy. My personal understanding of plasma therapy is that, so what does plasma therapy do? It transfers antibodies against the SARS-CoV-2 virus from someone who's recovered and is present in their plasma into someone who's got infected. So let's dispassionately, logically look at it. So you're putting antibodies in. So these antibodies will work when the virus has just got into the body and is trying to bind to the human cells. So, you can actually prevent the binding, or those antibodies can interfere with what the virus is trying to do in terms of replication, multiplication, and so on and so forth. So I believe that plasma, perhaps conceptually, and again, we don't have data on this at this point in time, needs to be given very, very early. But what has happened in the past, based on all the data that has emerged from across the globe, it's been given in very sick people where it's not going to do anything. Because, what does it have? It has antibodies that are going to block. Now, when the blockage has happened, all the inflammation's gone in, the cytokine storm is full blown. What do you expect the poor antibodies to do in the plasma? It's not going to work. So it perhaps needs to be given at a very early stage. As far as what was the second question about plasma along with plasma?
No, it was how do oxygen concentrators help? Should we have one at home? Yeah.
Don't need an oxygen concentrator if you're talking about a kid. Basically what they do is they pull out the oxygen from the atmosphere, and they provide oxygen to someone who needs it, just like a cylinder would, or just like in hospitals we have piped gas oxygen. So that's what it does. But I would go around buying one for my child, because my question is, what all will you buy?
Yeah, that's very true. That is very true, Doc. So, Doc, anything that you can say to take the fear out of everybody right now for their kids?
Don't read too much. And I recognize so many names here, and I'm not actually take names and say, listen, some of you read just too much. So please don't read, because we in the world of medicine are really struggling to keep ourselves abreast. And let me give you a little story. They say that in medical school, typically if a medical student falls ill with anything, fever, this or that, or swelling anywhere, the diagnosis that he or she thinks he is suffering from is usually fatal. It's usually the worst disease they can think of.
Yes.
So, and that's because you've read so much, and then you try and overinterpret things and stuff like that. So I would urge you not to read too much about it. A lot of information that you have, is subject to misinformation. And I'm not saying it's done, in that manner, but quite often, people just read something, they forward it, or they forward something that, somebody said in another country. It's not particularly relevant to the scenario here. And then you tend to worry and agonize, and then you do a Google search, and then it gets worse. So I would urge you not. I think everybody in India has enough basic knowledge about COVID-19. Everybody does. So now you're trying to get into some very finer points, which I think you should let the specialists deal with that, and actually take advice and not read too much. Because if you read too much, I promise you, you're going to get confused. You're going to get very worried. You're going to have sleepless nights. imagining the worst. So please don't think.
True, and don't go to Dr. Google. When
Absolutely.
yeah. Okay, and we'll just take two more questions, Doc, from Tanvi. Is it true that virus travels through shafts? We have had cases in our condominium where the cases moved vertically up or down.
So, when we first started studying this virus, it was all about droplets. And now
Yes.
there is a hypothesis that it's not droplets alone, it is also airborne. And, once you talk about something being airborne, then it kind of makes it a lot more complicated because, then controlling it becomes so hard.
Yeah, true. Doc, can you just actually, for everybody watching, can you actually give the definition of what is airborne? Because again, it's...
So like airborne is like if you are speaking and I'm speaking and we are in the same room. So droplet means that, if you're coughing or sneezing or shouting, right? So that's where the droplets are, because then the size, of how this virus travels is different to when it's airborne. Airborne, it's like in the air. So if you're in a closed environment and someone who's positive has spent time there, then it's in the atmosphere and you can get it. Whereas if it's droplets, then, you need to be exposed through either that person coughing or sneezing or yelling or whatever.
Right. So what would be a safe distance to prevent airborne?
If it's airborne, then there is no safe distance, no?
Nothing. Okay. And that's perhaps
why
one
you
of the
need to
reasons.
be masked at all times. So really embrace masking. It's the single most important thing out of the three.
Yeah. And they're saying mask at home as well, Doc. Do you ascribe to that?
Well, listen, it depends now. If you've got a lot of staff coming, the staff and you need to keep yourself separate. Now, if it's about your children and your partner, and again, it depends on who goes out, who they're in contact with, what is the level of precautions that they take. Everyone's different. There's some people who are very, very particular. There's some people who are very casual. I personally believe that where a lot of problems happen when people go out to work because nobody's socializing is when you have tea or coffee or eat. That's where the problem is. So in fact, in a hospital now, we don't let two employees eat together or have coffee together because that's when the mask goes off. And if you're asymptomatic, you can pass it on. And I know it's hard. We are all social animals and we want that proximity to someone and to talk. But you talk with a mask on. You want to eat, you want to drink. Please, you have to move away.
Yeah, keep it at a distance. Okay, and now just the last thing. Is it safe for your kids to be on a terrace or a garden without a mask?
That's fine.
Yeah, it's fine. Okay. Dr. Sibal, thank you so very much. We've taken more time and it's really a privilege and a pleasure to have you with us today for Need of the Hour. And thank you so very much for joining us today.
Privilege, and I just hope that you're a little more relaxed than you were when we started.
Yes, I think all the mothers, like you said, mothers and fathers who have joined us today, everybody's feeling a sense of one, more just understanding stuff, and two, more clarifying some of their questions, and three, less panic, so more calmer in the state of wherever we are. We're in the storm. So I think the calmness that we maintain is really key here.
Absolutely. God bless. Be safe. Don't let your guard down. Please don't do that.
Thank you so much.
Bye-bye.
So everyone, thank you very much for joining us for Need of the Hour. We will be back with you tomorrow with Dr. Jasmine Kumar, and she's an author and a parenting coach. So please do join us 5:30 to 6 p.m. tomorrow. Thanks very much, Doc.